الرحمن الرحيم. Uh, Bismillah ar-Rahman ar-Rahim. Nahmaduhu wa nusalli ala Rasulil Kareem. So, yesterday we discussed that masla in detail about vaginal discharge. Ne? It's clear, is everything all right? Phone is flat, so we're using my phone. So anybody can just, from the online people, indicate to me that everything is clear. We're using a different phone. Please just indicate to me that everything is okay, everything is fine. Right. Is everything okay? Sure. Right. So we, so this I just want to recap everything what we done, and there's something else that I never understand properly yesterday, but I got clarity on it. So I want to share with you that as well. And actually, to be honest, here, I went to ask on the Mufti's chat, and nobody responded, but at least one Mufti, Allah Ta'ala reward him, Alhamdulillah. He explained me till I understood it properly. The thing was, I was not sure about this. Remember, we told you there's three types of discharge, right? So we know the one is comes from deep in from the fallopian tubes, whatever that is, najis. And we know one comes on the exterior and one, the middle one, the muhtala. What is it? Where exactly does it come? We say there's ikhtilaf between the ulama, and we say if a person got difficulty, then she must practice upon this, upon Imam Hanifa's opinion. So exactly where that comes from, that was which I actually was wanted some clarity on that day. And I tell you, I spoke with one mufti, and he's the same one that is quite experienced in the Haidh Messiah. So he explained it. So before to understand what he's saying, or what understand, let we go one step back, and the step back is this here. Remember, we said I told you when we were in the madrasa, one of senior student of ours spoke to one of the ustads, in fact, our principal, and he explained it the whole masla like this. And I want to take you back to that to understand the masla. To understand this masla, imagine your mouth, right? So you got your lips, right? Which is what we term as the labia majora, right? And your teeth is the labia minora, right? So that is the two sets of lips of a lady, right? Now listen nicely. We said the first type of liquid, just so if you close your teeth, look at me, you close your teeth and you open your lips, close your teeth, your lips. So anything that comes on the outside of the lips, or even under the lips here and between the gums, and comes here, your teeth is closed. Your teeth is closed. Remember, your teeth is closed. So anything that comes from on top, on the side of the lips, or even the skin between, because sometimes ladies are different. Sometimes the labia majora is way bigger than the labia minora. Sometimes happen the labia minora, the inside lips is even bigger than the outside lips. So you see the outside lips sticking outside the inside, sticking out of the outside lips. But anyway, the normal person look at me. Your teeth is closed. Your teeth is closed, right? So anything that comes in between is here under my gums and between my lips here, so long as my teeth is closed, that is the first one. No ikhtilaf in that one. That is the and this made it easy to understand. You see, if you look at the male organ also, right? Now, normally an uncircumcised person, you call it the foreskin, right? And also the technicals it's called a prepuce, right? So now, when does your wudu break? When does your wudu break? When the urine come out of the foreskin, or must it just come out from the tip of the hole? When does your wudu break? It, it doesn't have to come out of the foreskin. It just have to come out of the actual organ. You understand what I'm saying? So same thing. This outer lips is like the foreskin. It is like the prepuce. It's like the prepuce of a woman. So all that comes in between the lips and the gums, that is the first one. There's no ikhtilaf, right? Now, if you open your teeth, now imagine the teeth is the second set of lips. Now, something that comes inside, from between the teeth, between my two teeth, that is the mukhtalafi one. That is the one which Imam Hanifa says it does not break the wudu. And then we also said, as long as it doesn't, yes, the one that comes from the second set of lips, it will not be exactly like the first side, the one that comes from first set of lips. The one coming out of the lips, that is like pure perspiration. So this one here that comes from beyond the teeth or comes in between the second set of lips, it is slightly thicker. It is slightly thicker than the perspiration, and also it is um, it is slightly slimy also, and it also has a mild smell. So that one, as long as it does not have blood in it, or it's not mixed with sperm, like the woman's arousal sperm, or a woman hasn't been aroused, so it never comes as a result of that arousal, then then that inshallah also that is not najis and will not break the wudu. Are you with me? Yes, what comes beyond that? Now, what comes from if you go like into the second set of those, you go deeper in where you go past maybe the birth canal and from further in. Now, that which comes from the fallopian tubes or from the womb or whatever, that is normally the one that has very thick texture, very thick smell, etc. So I hope that clarifies it. So that clarifies it. So I was telling you, if you understood that properly, if you understood that properly, that if you understood that the outer lips is like the foreskin of a man, then you'll also understand that when any urine or anything or blood, it comes past the first lips, then already the wudu's broken. Because I told you the second lips is what? The second lips is the second lips is like this foreskin, and for your wudu to break, the najasa don't have to come past the foreskin, don't have to come past the foreskin. The moment it comes out of the actual organ, and even if it's stuck in the foreskin, which that's one of the reasons why obviously we say al asharu mil fitra, that why we circumcise, because many times the najasa gets stuck in there, etc., etc. Are you with me? Right? So so, uh, so, if you understood this properly, you'll understand these Messiah now properly. Like the old style pad that the woman used, the old style where you stick it on the surface of the outer lips. So if the blood comes onto that pad, that shows you obviously the wudu is broken, the haze is started because that is beyond the first set of lips. It has already come to the foreskin, right? That's what I'm saying. So if a woman now puts the tampon in and it goes, obviously the tampon goes past the first lips, it goes into the second set of lips. If it goes into the second set of lips, right, and only the tip which is inside that got soiled, and the outside and say whatever it is, maybe it's a tampon or whatever, and a portion is sticking out, and the portion that is sticking out goes beyond the first set of lips, the labia minora, then obviously it is clear the najasa has gone beyond the first set of that lips. So obviously wudu is broken. But if or Haidh has started, if it was Haidh must the Haidh has started, whatever. But if that thing is stuck deep in to such an extent that the portion of the tampon or whatever it is, it doesn't pass the first lips, and then the najasa is there, then obviously wudu will not be broken if that thing. Only yes, when the person take it out now that the najasa came out. Are you with me? So I hope that clarifies that masla, inshallah, very beneficial. We can benefit. So alhamdulillah, we've come to the end of that discussion now. Of we done the hays, we done. I told you the usul we done. Inshallah, it's supposed to cover at least up to 80% of the Messiah. Yeah, yes, there are certain Messiah maybe that we won't find in usul which we done, but that we have to go into the mutawalat. Right, we will do it one of these days, not in the near future, but maybe in a year or two time, we'll arrange for that to be taught. So now the next chapter, inshallah, we're going to do is Allah Ta'ala accept that from us, give us the tawfiq to implement it, and also we can help people who are in need also with it, help them, guide them with their Haidh Masail, inshallah. Right. Faslun fin nifasi, the next chapter is the chapter with regards to nifas, you can say postnatal bleeding or after childbirth, whatever. So normally, obviously, nifas is a more rare occurrence. It is a more rare occurrence than haze. That's why it is brought after haze. And in fact, it's even a more rare occurrence than istihaadha. And this can the root words are nafisa, nafisa with a sin, nafisa. Right. So istilahan technically means الدم الخارج عقيب الولادة, the blood that comes out after childbirth. After a woman gives birth and the blood comes. Okay, read Bismillah, تفضل. Right, right. So I told you Nafisa is the Sulati Mujarrad. Then tanaffasa yatanaffasu means to expel something, to discharge something. That's why you say, La budda lil masduri ayyan fusa. The person that has been pressurized, a time will come when he will lash out, when he need to let off his steam. So one nifas, so that means tanafas means to release something, right? So obviously the woman after giving birth, she releases that blood, right? One nifasu wa damul khariju. Nifas, it is the blood. Al khariju, most of it that comes out aqib al wiladati, after childbirth, right? Why we say, what is the, we say, wajh ishtiqaq, like why do we use this word? لأنه مأخوذ من تنفس الرحم بالدم, because it is taken from the releasing of the womb blood. The womb release, it discharges, or yeah, right, it expels bloods, right? ومن خروج النفس, and also like when your nafs تنفس means to breathe out, like لابد للمسؤول أن يتنفس, right? ومن خروج نفسي, right, right, بمعنى الولد, like she, when a woman gives birth she expels what, a nafs, a human being from her, right? So that is the link, that after the expelling of a human being with the nafs, nifas comes after, right? أو بمعنى الدم, or it could be that she's expelling blood, but anyway, okay, that is just some, what we say, what wajhul ishtiqaq, the reason or the wisdom behind the meaning. Okay, so that, read the first masla, inshallah. Okay, first thing before we look at it, but that in the kitab, I want to tell you something. See, according to the Hanafi madhab, it's impossible for a woman to get haze while she's pregnant. Even if she bleeds during her pregnancy, sometimes, women, when they are pregnant, then they start spotting, then they start panicking, or they go to the doctor, then the doctor checks their levels and say, no, they can actually check the levels and say, no, the pregnancy is still good, the pregnancy is sound, whatever. Or sometimes they check the levels, they see the pregnancy levels are low, then they give you some medication, whatever. So, so but now, from a medical point of view, I'm not sure about that. Maybe medically it is possible for a human to have haze in during pregnancy, but from a Shari'i point of view, from a Hanafi point of view, it is impossible to have uh, haze or menses while she are pregnant. If a woman bleeds, she spots whatever during pregnancy, that will be istihada. Remember, istihada is the opposite of haze, right? So let's look at it. وَالدَّمُ الَّذِي, the blood, تَرَاهُ الْحَامِلُ, that a pregnant woman sees. ابتداء, at the beginning of a, right? Or حال of a, ابتداء, at the beginning of a pregnancy. أو حال ولادتها. You got wiladati or waladati? Or during the birth. So in other words, she's like how they say, I'm not so familiar with this. I should always disappear when this thing starts happening. I should find some excuse to disappear. So I'm not so sure about those things. But anyway, حال قبل خروج الولد. Um, until the baby hasn't come out as yet, whatever blood she sees, that will also not be haze. It is istihada. So just look at me 1 minute. So see, we done this principle here. للأكثر حكم الكل, for the greater will give the hukam of all. So only when the more than 50% of the baby has come out or appeared, now we will say that she's given birth, and now it is nifas. But until the greater majority of the baby hasn't come out, it's not nifas. So if it's not nifas, that means it's istihada. So that means salat is not waived. Are you with me? So even so, listen to this. The strict application of the law. If a woman is busy giving birth, and the head of the baby is out, the head of the baby is out, because the majority of the baby is not out as yet. It is not nifas. It's only nifas when 50% or more of the baby come out. So it is tihada. So she still have to read salah, right? So whether she can read salah, whether she's in a condition to read salah, that's a different story. But obviously if she's by the ability to read salah, she must read the salah. But if she can't read salah, maybe the pain is too great, whatever, then what's the benefit? It means the salah has become a qada upon her. Are you with me? That is why I told you, the mutawalat means the detailed books of fiqh. There's a masla, I strange that I've seen the detailed books of fiqh is mentioned there. If a woman is busy giving birth, right? And she's and the whole baby is not yet out, right? Then she must make, they say that they must make a, like in previous today, you got no hospital beds and all it. She must make a hole in the ground and a portion of the baby must be in there and she must continue and read a salah. So, two things we learn from that. The first thing we learn is see what a great attachment our fuqaha has attached to your salah, that under no circumstances, even if you're busy giving birth, you still have to read your salah. That's the first thing. And the second, yeah, that's the first thing that you see. Like there's no ma for salah. And the second, to show you that I told you only once more than 50% of the baby comes out. Now we'll say the baby was born, and now we'll say it is nifas, and now we'll say salat is maaf. You understand what I'm saying? Because nifas has begun. Because nifas has begun. So until not more than 50% of the baby is out, right? She's still considered to be a pregnant lady, and whatever bleeding a pregnant lady see will be istihaadha, and we know istihaadha does not make salama. Are you with me, right? See the وَإِنْ كَانَ مُمْتَدًّا, even though it's for a long time. So nowadays, we know the lady here, nowadays the ladies, they just want to cut, cut, cut. They want to go to the chop shop and cut. They don't want to bear the pangs of birth. So in previous days, obviously cutting etc. was not so easy. So sometimes maybe the lady will be in the pangs of birth for days, 1 day, 2 day, 3 days, right? Waiting for, and obviously medicine wasn't so advanced. So here he's saying, even if a long period of time, even if it goes for 1 day, 2 days, we will say it is not nifas until more than 50% of the baby comes out, right? So we will say she still have to read a salah. And obviously she can read a salah, she'll read, but if she's not in the condition, she'll have to remember she got the qada there, right? Are you with me? Right. وقال الشافعي رحمه الله حيض اعتبارا بالنفاس. Interesting. Imam Shafi is of the opinion that a woman can experience haid while she's pregnant. A woman can experience haid. So it's quite an interesting difference of opinion between the Shafi. I told you, I'm not sure from a medical point of view now, that it can that a woman really have haid when she is pregnant, right? But anyway, Imam Shafi said that she can. So you see, وقال الشافعي حيض. He said this this bleeding she experiences when she is pregnant. It was so in other words, like Imam Shafi got the normal laws of Haidh, which is 1 day, etc., etc. If it follows that profile while she's pregnant, it will be considered to be. And what's i'tibaran bin nifasi? He say, look here, like a woman can experience nifas when she's pregnant, she can also experience Haidh, right? Right? إذ هما جميعا من الرحم, because it's look here, the blood of nifas and the blood of Haidh, they both come from the womb. So that the blood of womb comes when a woman is pregnant, the blood of nifas comes out from the womb. So same thing, the blood of Haidh can also come out, right? We say, now I told you, maybe the fuqaha, they explain things according to what they understood at that point in time. So maybe now with the advancement of what you call it, of medicine, etc., maybe it may not seem so accurate. So, but normally this understanding they just give as a auxiliary proof. The main proof is what we understand from the Quran and the Hadith, right? So here he's got his dalil aqli. He says, see, walana anna bil habli, that when a woman becomes pregnant, right? I tell you, maybe medically it's not like this, right? But it's just an added proof according to what they understood. So do not worry too much about yansaddu famur rahmi. When a woman is pregnant, then the mouth of the womb is closed, right? Because I'll add to that what happens. So if the mouth of the womb is closed, then the blood that comes from there can't be haze. The blood that comes from there can't be haze. You understand what I'm saying? Because istihada, istihada is not a right. One, and he says, look here, when a woman gives birth, right, that is when her womb opens. Her womb opens. And when her womb opens, then والنفاس بعد انتفاخه, after open the womb بخروج الولد. So yes, when a woman gives birth, now her womb reopens and the blood that comes from there is nifas. You understood that? ولهذا كان نفاسا بعد خروج الولد. That's right. What comes after the birth of the child is considered to be nifas. Are you with me? Okay, we got some input here from a medical person. Bleeding during pregnancy is decidual bleeding in the first 3 months of pregnancy. So I'm not sure what the decidual bleeding means. So the question here is, if a woman bleeds during a pregnancy, does it come from the same place where the normal haze come from? We know the haze. What is the haze? The haze is the egg that the woman produce. It attaches itself to the womb, né? And when that egg doesn't get fertilized, it tears itself off the womb and it gets expelled from the body. So that bleeding that comes out is actually the egg detaching himself from the womb and coming out of the body, right? Is that correct? You can tell me if I'm incorrect there. So, so that is from a medical point of view, right? Um, but maybe you can just answer this question for us: that uh, uh, does like how a woman experiences a monthly menses, that is the egg that is being produced in the fallopian tubes, does that also happen during pregnancy? I'm not sure. If anybody got input, they can share it with us. I'm not sure. So does the normal production of eggs take place in pregnancy, like how it takes out place out of pregnancy? I'm not sure. If anybody got it, they can help us, or else we can Google it. But the main thing is, even if it is, even if even if you tell me, yes, the body can produce eggs like how it does out of pregnancy, that will not impact upon the masla. It will not, because the Hanafis already assumed the position that that the bleeding during pregnancy is not haze. We can, Elijah, you should understand the point I'm making. Even if you tell me from a medical point of view, it is possible that the normal egg that is produced out of pregnancy, it can be produced in pregnancy. We'll still stand by our position that according to the Hanafi madhab, that is not haze, because there is also, besides this logical proof that we're trying to give you, there's a dalil and naqli also, right? So, ولهذا كان نفاسا بعد خروج الولد. That's why we say that when the child comes out, the womb opens, right? Now, I told you, again, I mentioned earlier, maybe from a medical point of view, this doesn't make sense. But this is what the Fuqaha explained. And they just give this as extra. The real thing is what they understood from the Quran, from the Hadith, and what they understood from the Sahaba Ikram. This is just added things that they put in their side, right? So, وَلِهَذَا كَانَ نِفَاسًا بَعْدَ خُرُوجِ الْوَلَدِ. That is why nifas is after the birth of the child, when the womb open up, right? فيما روي عن أبي حنيفة, and this is what is narrated from Imam Hanifa ومحمد and Muhammad, لأنه لا ينتفخ, because فيتنفس به لأنه ينتفخ, because with the birth the womb opens up, فيتنفس, and it expels that blood, right? So if all of this here never makes sense to you, it doesn't matter. Doesn't matter. The main thing you need to understand, according to Hanafi madhab, there is other naqli textual evidence that suggests that a woman in her pregnancy should not experience that. She does not experience haze. Now, the next ibarat here is a very interesting ibarat, and I'll tell you why it is a very. We get this question lots of times, and the question that we get so abundantly is understood in the next text. And the question is this here: that a woman was pregnant, and the early stages of her pregnancy, she miscarried. So, what is the law? Will that miscarriage be, will it have the laws of nifas, or will it have the laws of haid? So, maybe a woman was pregnant for 2 months, she was pregnant for 3 months, right? And then she miscarried, right? So, now she miscarried, she's bleeding. How do we categorize that bleeding? Is it nafas? If it was nifas, it means if she was sitting in the iddat. Remember, if a pregnant woman is sitting in iddat, then the iddat terminates with giving birth, right? So do we consider it as a birth, right? Or if it's not a miscarriage, does she stop reading salah? Is it Haidh? That's what I'm saying. Must she stop having a relationship with the husband? So all of that, I told you, very, very common question that the muftis get. We will discuss that tomorrow. If a woman miscarries in the early stages of pregnancy, is it nifas or is it Haidh? That will be discussed tomorrow, inshallah. بس سبحان الله وبحمده سبحانك اللهم وبحمدك ونشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. Will you be able to save it from this phone also?